All right. Welcome, everyone. My name is Cole Kelly from the Capital Group. I am the senior client manager that has been working with Paragon Force now for the last 2 years, along with my colleague Doug Gray, the senior client executive. So we are very happy to be here today to be presenting on the benefits that will renew 12/1. So a little bit out of turn, but I will say United Healthcare is our un- our current medical provider. Obviously, we had a very interesting renewal, I will say, with the carrier, and to that end, we have been able to secure, a renewal with the carrier where we will still be offering nationwide participating providers that utilize the United Healthcare Choice and Choice Plus networks. In addition to the United Healthcare Medical Program, we are still offering our dental and vision through Unum. And we are still continuing our life and disability through Unum as well. So, again, thank you all for your time today. I think it goes without saying that without you folks, we would have no reason to be here. So, again, I thank you for your time, and I will do my best to keep this as high level and informative as possible. Now, understand that you also will facilitate your enrollment through the Employee Navigator platform. That is where all benefits, enrollments, elections, and waivers will be processed. So again, thank you all for your time today, and let's go ahead and get started. So first, who can enroll? Well, if you are working at least 30 hours a week, congratulations, you are considered a benefits eligible employee. And with your enrollment, you are also able to enroll your legal spouse or eligible domestic partner, children under the age of 26, and qualified disabled dependents. Now, today's presentation will cover open enrollment. So it has already started and will end on November 9th. This presentation will cover who is eligible. As we already just covered there, if you're a full-time benefits eligible employee of 30 hours a week, you can enroll along with your applicable spouse, domestic partner, and child dependent. And folks, as this conversation is being recorded, if we could please make sure our microphones are muted to mitigate background noise, I would really appreciate that. As we continue forward, looking at a high-level overview of the medical plans, we'll look at the dental and vision offerings from Unum, along with the life and disability or our income protection plans, information on our flexible spending accounts, and final reminders and resources. Now, before we jump into the meat and potatoes of the presentation, we have some key terms that we find are important to have some base familiarity with. So certainly this is not an exhaustive list. However, some terms that are important to have some understanding of. So we'll start from the top and work our way down. Starting from the top, it's copayment, deductible, coinsurance, and then finally your out-of-pocket maximum. So copayment, simply put, a copayment is a dollar amount that you will pay out of pocket at the time that you receive care. Now, depending upon the plan that you enroll into and how that works, you may have the deductible that you have to meet first before you receive that copayment, or you may very well just have that copayment before the deductible. Now, when that you do render a copayment, typically that's the only amount of money that is due for that service, and copayments do not apply towards your deductible. Now, deductible. Simply put, a deductible is a predetermined amount that you will have to pay out of pocket before the insurance company will begin to pay their portion of the claims. Now, as I briefly mentioned, some services may be available to you at first dollar coverage, meaning no deductible needs to be met. However, there may be services that require the deductible to be met, and your deductible amount will change based upon how you enroll. If you enroll as an employee only, you will have the single deductible. The moment you add one or more persons to the plan, it jumps up into the family deductible. Now, next is coinsurance. Instead of a flat dollar amount, like copayment, coinsurance, as the name suggests, represents a cost share between you and the insurance company. A typical coinsurance is our 80/20, 70/30, with the higher portion, the amount that is covered by the carrier, and that lower amount, your responsibility. Next and final is out of pocket maximum. Now, this is a relatively new provision that was built out of the Affordable Care Act. Before that was passed, insurance companies could just continuously require you to pay co-payments, co-payments, co-payments. So if you've satisfied your deductible and you're admitted to the hospital and you have years worth of hospitalizations, there was no dollar amount or figure that was in place to prevent you from continuously paying on your plan. Now, there is this dollar amount, and speaking in network, assuming we've hit this dollar amount and your out of pocket maximum does change based upon how you enroll, similarly to your deductible. Once you've hit your out of pocket maximum, aside from your monthly premiums, everything in the plan will be rendered at 100%. Now, obviously, I hope one never hits their out of pocket maximum because it implies that you've had a very expensive plan year. But do know that if you do have an expensive plan year, you will not have to pay more than your out of pocket maximum on the plan that you enroll in. All right. So, folks, as a United Healthcare member, you'll have access to one of the largest networks in the country. The United Healthcare Network covers uh, 96 of all U.S. counties. The United Healthcare Network currently includes 800,000 doctors and healthcare professionals, including clinics, labs, care centers, more than 5,700 hospitals, and more than 30,000 pharmacies. And to find an in network pharmacy, all one would need to do is just go to myuhc.com, or as a little plug to some of the other portions of this presentation, you can download your Health for Me app, where you can start to receive all the bits of your healthcare on your mobile device. All right, folks. So next slide, I'll cover the medical plans that we have for our review. Now, one thing I do want to point out before we get into the analysis of these medical plans is that regardless of which plan you select, you will have built into your plan once a year annual well child care and adult physicals. So it does not matter out of the three plans that you select which one you enroll into if you are someone who only gets your annual wellness service taken care of. It's all the same under the plans. Now, to that end, there are going to be differences between something that is called preventative and diagnostic. So, your preventative levels are going to be when you have your annual wellness visit. That is a preventative visit. That's going to be rendered at no cost to you in network, regardless of which plan you elect. Now, if you are someone who is going to your annual wellness visit and you attempt to have them diagnose another issue, let's say, for example, and I've done this myself, I'm going here for my annual physical, but hey, doctor, my shoulder makes this clicking sound when I lift my arm. Well, that changes the coding from preventative to diagnostic, meaning that you would then have a copayment or a deductible to satisfy before you enjoy that cost share. So if you do have any questions about what is considered preventative care under the United Healthcare Plan, certainly feel free to navigate to uhcpreventivecare.com for more information. All right, folks. So now we are in our comparison portion of this presentation. So we have three plans here for your review. We have the Choice Plus, the BT7X, Choice Plus C, F as in Frank, Z as in Z 5, and then the Choice HSA. So I am going to reference this as our, just for the purpose of this conversation here, our plus BT, our plus CF, and then our HSA. So first, let's look at these plans side by side to see how similarly they are to one another. So both of these plans are nationwide in scope. Actually, all three of these plans are going to be nationwide in scope. So I want you to understand that all three of these plans will utilize the same in-network benefit, the choice network. The only difference here that you're going to see between these two plans compared to our HSA plan is that they offer an out-of-network component here. And I'm going to discuss the out-of-network benefits together at the end of this slide. But first, both of our plans here, the BT and the CF, Choice Plus, have an individual deductible of $3,000 and $6,000 for the family. Now you'll see when it comes to the out-of-pocket maximum, it's slightly lower on the BT plan and slightly higher on the CF. However, you'll also notice that under those plans, out-of-network benefits tend to scale a little bit better on the CF plan versus the BT. And again, I'll discuss what those out-of-network benefits look like together at the end of this slide. But both of these plans will offer the same in-network copay of $35 for your primary care. Under all three of these plans, you do not need to establish a primary care physician relationship, and you can self-refer to a specialty provider of your choice. Now, with this specialty copay, you're looking at $70 per specialty provider visit, no deductible needed. Same with your primary care physician. As I mentioned on the earlier slide, preventative care, as long as you're getting your preventative and not diagnostic, will be covered at 100% for your annual wellness visit. Then with labs and x-rays, including simple labs, x-rays, and diagnostics, and your major x-rays and diagnostics, you're looking at deductible under the BT plan. And then that is 3,000 for the individual or 6,000 for the family before you enjoy the co-insurance of 80%. 20% is your responsibility. Now, one nice thing about co-insurance on those higher ticket items is that as medical cost tends to increase, the 80% co-insurance that you receive from the carrier scales with the cost of inflation. So I understand under your more commonly used services, your primary care specialty providers, having those co-payments even a little bit higher makes it nicer and easier to understand that your responsibility at the time of care. Um, However, um, you would be able to receive a higher reimbursement under this plan with this co-insurance because it would scale. Now, again, urgent care, a co-payment of $100 per visit. And then if you have an emergency room admission, this plan, it's $300 for a copay admission. And then you have a 20% responsibility on top of that for the emergency room. And again, that's all allowed amounts with your in-network provider. In-network providers can never charge above the allowed amount with the carrier. So you are receiving 20% co-insurance on the allowed amount, way better reimbursement than you would ever receive on an out-of-network benefit. Looking here as well under this BT plus, it's deductible than 20% coinsurance for an inpatient hospital stay. If you are admitted to the hospital through the emergency room, that copayment you would typically waive for the ER is waived, meaning you just have the inpatient hospital copay of your deductible, then 20% coinsurance. Now, our next plan, this CF, very similar in scope, folks. Where you're really going to see these bigger differences is going to be in the co-insurance. So instead of being offered at an 80-20 split, this CF plan, it's at a 50-50 split. So the reimbursement isn't as rich. So I would encourage maybe potential enrollment on this plan if you have a higher utilization. If you maybe are someone who likes to go to your primary care physician appointments enough in the year, but you're never going to hit your full deductible amount, but you anticipate or understand I'm probably not going to have an inpatient hospitalization or needs for labs, x-rays, and things like that, then maybe this Choice Plus plan here, the CF, would work well for you. But understand when it comes to your labs, x-rays, you have a slightly reduced coinsurance of a 50-50 split. Urgent care, same copayment as the first plan, $100, and a similar copayment for your emergency room, but instead of a 20% amount that you're responsible for, you are responsible for 50% of that cost, 50% covered by United Healthcare. And that's the same for the inpatient hospital stay as well. All right, folks. And then the final plan that we have here is our HSA qualified plan. So, to be clear, if you decide to enroll into the qualified high deductible health plan, this HSA plan, you must meet that full deductible, and your deductible does change based upon how you enroll. And it's 6,550 for the individual and 13,100 for the family that you will have to pay out of pocket if you enroll in this plan before you enjoy any cost share under this plan. However, you can see that this plan makes it very easy to understand what your cost share is after you've met your deductible. It's $0 after deductible. You'll see that your out-of-pocket maximum is very close to your actual deductible amount, and that is on purpose. There are going to be very few things that will have to be of any cost to you once you've hit your deductible amount under this plan. So aside from your monthly premiums, once you've hit your deductible amount under this plan, most of the services under this plan will be rendered at no cost to you. Absolutely tremendous benefit rich plan if you are someone who always hits your annual deductible. Now, we are switching gears into the wellness and value adds portion of this presentation. And first, I will start with the virtual visits program with United Healthcare. So as I've already mentioned, myuhc.com is the online website, or you can utilize the Health for Me app. This will be where you are able to go online and find a provider to help you with a whole host of medical conditions. Some examples are going to be flus, rashes, um, minor illnesses, pink eye, UTIs, just basic illnesses. For example, I've anecdotally have used multiple virtual visits, but one of the first times I've used it, I pulled my back and I needed to get a prescription for prednisone. And being able to do that from my phone, at the time it was at the office, and I thought, wow, it was so nice not to have to leave the office to go to the doctor's. But it was nice being able to get something rendered very quickly and very timely. It's convenient because you can utilize your virtual visits when your primary care physician is not available. If you're traveling and you become ill, and if you're considering visiting a hospital or emergency room or other urgent care clinic and you want some potential advice before you have to go for care to see if you really need that emergency room visit. So, folks, to that end, I will let you know you have a whole host of alternative health options to you before your emergency room. I grew up in a rural area of Pennsylvania, a town of no more than 2,000 people. I did not enjoy the benefits of an urgent care clinic growing up. We just had the local hospital, which was 20 miles away. So immediately, we did not have anything cheaper than that. But here in this world and day and age, we have many options available to us. So, as I mentioned, first, virtual visit. So for your simple illnesses, your pink eye, rashes, flu, sinus problems, cough, cold, bronchitis, you have your convenience care clinic for that step up for common infections, vaccinations, pregnancy tests. This is a convenience care clinic where you can't see your primary care, and the health issue isn't too urgent. Now, these clinics are often in retail stores. Now, your primary care physician, we all know who they are. I always encourage you folks, even though the plans do not require you to establish a primary care physician relationship, that you still do so, because having someone who can help guide your care and someone who is a focal point for your basic checkups, preventative services, and minor conditions, vaccinations, and general health management is absolutely wonderful. But you'll see we start to dip up into your costs here when we look at our urgent care and emergency rooms. Urgent care, we all know for those other two plans, it's going to be a $100 copay and then deductible than $0 under the HSA. But your urgent care is when you need care quickly, but it's not too emergent. Sprains, strains, small cuts that may need simple stitches, minor burns, minor broken bones. And that's a little costly, but it's certainly not as costly as your emergency room, which is for your life threatening and very serious conditions. All to that, I will never say, folks, do not use an emergency room. You know yourself best. But I am only offering advice and information on these areas of care because hospitals in today's day and age are getting very, very specific when it comes to what is emergent. So while we do have a nationwide plan under all of our plans for in-network hospitalization coverages, you'll always have a few options of care that are a little bit more costly, rather more affordable than just your emergency room visits. All right. So now we are rounding out into our prescriptions portion of the conversation. So, how we cover prescriptions. So, United Healthcare, like every other carrier, has something called a prescription drug list. It's a list of the prescriptions that are covered by the plan. Now, these are something that are changing every quarter, I would say. Every quarter, you have the potential of having your medication change on the formulary and where it falls. Obviously, it's something that I don't enjoy when it happens, but being ultimately transparent in how our carrier partners work is very important for us. So understand if you are someone who takes maintenance medications and you are taking a tier one, tier two, or tier three medication, it is because this PDF document basically says this is where it falls with regard to our reimbursement. Now, tier one is going to be your generic level, your lowest cost medication. Then your tier two is going to be your preferred brand, and your tier three is your non preferred brand. So your tier two is going to be your mid cost medications, but the brands that they prefer to work with. And then finally, your tier three is going to be your highest medications. Now, with this plan, we have our HSA qualified plan up top. And then our two options here are CF and BT Choice Plus. So our Choice Plus HSA is going to require you to meet your deductible in full before you enjoy any cost share. So you have to meet that full deductible amount before you enjoy any cost share. And when you do, you'll have a $10 copayment for your generic, 40 for your preferred, and 85 for your non-preferred. But already for you folks, you will start to, on the other two plans, be able to recognize your co-payments under the pharmacy. For your generic level, your tier one, it's a $10 co-payment for a 30-day supply. For your tier two, your preferred brand, it's $35 for a 30-day supply. And your tier three, your non-preferred brand, is $70 for a 30-day supply. Now, you will have the opportunity to utilize the Mail Service Members Select Home Delivery Pharmacy Program, which will enable you to receive your ongoing medications by mail. This program will help you to save time and money by managing this program right to your home. It's very convenient because you tend to pay two and a half times the 30-day supply cost or for your 90-day supply through OptumRx. So I am someone who takes a Mazaproli for heartburn. I can get this delivered to me on a 90-day supply by paying two and a half times the 30-day supply. Absolutely awesome because I can't tell you how often I was going into CVS and just picking up their generic every month, and being able to get it delivered right to my home for $10, or rather 20 or 22 bucks and some change for a 90-day supply was absolutely wonderful. So I encourage you folks, if you take maintenance medications, to utilize the Optum RX mail order pharmacy. Now, in addition to the mail order pharmacy, you will have access to the specialty pharmacy with United Healthcare. Um, the specialty designated pharmacy program, designated provider by therapeutic class. What that means is that you will have access to a whole host of medications available through the specialty pharmacy program. Enrolled members will receive one on one support from nurses specially trained in your disease condition. You'll connect with a pharmacist or nurse to tell them about changes or complications in your therapy. And your specialty pharmacist or nurse can help you locate wellness coaching and disease management programs. And with this, you'll have access to your pharmacy and your medication quick and easy. A refrigerated medication will be delivered overnight directly to your home or office in temperature controlled packages, or the others will be sent to you within 1 to 3 days. Now, what's going to be considered to be the specialty designated pharmacy program? And what is this therapeutic class I just mentioned? So it really determines what type of medication you're taking. So if you're taking your HIV, juvenile rheumatoid arthritis, your multiple sclerosis, those will fall into the therapeutic class of similar injectables and things of that nature. If you are looking to participate with your psoriasis or other psoriatic arthritis, that could either be injectable or an oral medication. Similar to that is your rheumatoid arthritis medication and your transplant medications as well. So certainly where they fall will determine whether what therapeutic class it falls into. But just to really drive home this main point, that if you are someone who needs to take a very powerful medication, and anecdotally, I'm always happy to share real life examples. I'm taking something for psoriatic arthritis called Otezla, and this is what falls under an oral therapeutic class medication, and so would have to be rendered through the Optum RX specialty pharmacy program. And I encourage you folks, you get tremendous savings by participating with this program. So if you are taking medications like that, I encourage you to use the specialty designated pharmacy for your needs. Now, folks, we are jumping into the member resources portion of this presentation. And first and foremost, the Care Cash program. So the Care Cash program, essentially what this does, incentivizes you to become a little bit healthier. One, by giving you money. So if you enroll into any of the medical plans, you will be able to receive $200 if you enroll as an employee only. If you enroll as a family level, you will receive $500. Now, this card is reloadable with any remaining balance rolling over year after year. Now, what this Care Cash is used for is to help you pay for expenses within the United Healthcare plan, such as primary care copay visits, virtual visits, urgent care visits, and even outpatient behavioral health visits. Now, Care Cash is available to all employees and not just those who are high utilizers of healthcare. Now, the idea is that by receiving this money, you'll be able to stay healthier and take ownership of your health. By utilizing these funds, you can use this to pay for your primary care physician visits, lowering your overall cost by an estimated 7%. And 7 out of 10 employees of the first 40% activated their Care Cash and used their card. Very tremendous activation and utilization benefit. And more than $2,000 estimated in average savings per virtual visit when an employee shifts from an ER visit to the ER visit utilizing these care cash funds available to you. So how it will work, you will receive information about Care Cash and can request the card on myuhc.com. Now, once received rather, and activated, you can use it for certain eligible healthcare expenses. And you'll have access to viewing other programs and benefits through myuhc.com by accessing the toll-free number on the back of your card. Now, this plan here is motion with HSA. So this is really earmarked for you employees that are participating in the health savings account. So what you can do is that you can establish a fitness goal that can motivate you to receive to that can motivate you to achieve your fitness goals by receiving money. So walk 6 times a day with at least an hour in between each walk. If you move with intensity for 30 continuous minutes a day, or you complete 10,000 steps in your day, you can receive financial incentives to achieve this goal. You could earn over $1,000 per year when you get moving. I apologize. I just realized that that slide did not shift. So you're probably wondering what I was talking about. So let me just reiterate real quick, folks. For those of you that participate in the HSA, you can enroll into the Motion program where biking, walking, running, it doesn't matter. Achieve your fitness goal, try for one or do all three. And again, it's either frequency, 6 times a day with at least an hour in between, intensity, continuous movements for at least 30 minutes a day, or tenacity, more than 10,000 steps. And if you aren't able to hit your goal, you'll get 25 cents for just moving and syncing your tracker up to motion. Your Fit rewards will be deposited quarterly, and you could earn over $1,000 when you get moving. All right. So as I've mentioned, motion for HSA, it's a financial incentive there. Not going to get too deep into it, but folks, you can get into the program by visiting unitedhealthcaremotion.com to register and activate your United Healthcare Motion account. Download the app and pair it to your current fitness tracker and start earning incentives off of one of those 3 pillars. Now, as I've already mentioned, in addition to your Health for Me app, you have access to your myuhc.com platform. This is a platform which will have all the information on your benefits and coverage, where you will be able to find doctors and physicians in your area, manage your claims, manage your prescriptions, even interact with your online pharmacy with Optum RX or the specialty pharmacy, track your medical expenses, connect to your virtual physicians, and even receive discounts through the United Health Allies platform. And as I've already mentioned, the Health for Me app. Get your information on the go. What I love most about it is that you are able to view and share your health ID card by email. I no longer have United Healthcare, however, my partner does, and when they need to utilize the plan, makes it very, very simple. Truly, I just pull up the app, and I email the card to the provider, boom, done. So wonderful benefit there. You can also access all that information I mentioned on the website here on your smartphone, checking your account balances, deductibles, and out-of-pocket accumulations, paying for providers for out-of-pocket expenses, estimate costs of common procedures, finding in-network facilities, and connect with helpful professionals 24/7, your virtual doctors, and even search pharmacies, claims, drug pricing, and mail orders. Now, I've already mentioned the My Claims Manager with United Healthcare, so I won't go too deep into that as well. But again, an absolutely benefit-rich option here on the My UHC platform. Your My Healthcare Cost Estimator. This was actually one of my favorite things with United Healthcare, and something that I find that they do rather well comparatively to other carriers. So when you do create your My UHC account, it's based off of the plan that you elect here. And let's say, off in the future, we're looking at a medical carrier, we're trying to find, well, hey, what's this cost going to be if I need to get this surgery rendered? What's the cost here? And this calculator makes it very easy for you to estimate your expenses before you have the service rendered. All right, folks. So now we are switching gears into the Rally portion of this presentation. So Rally is offered by United Healthcare, which is another incentivization program that is here to help you achieve your goals by receiving individual personalized rewards. You'll receive step by step support, making the experience fun and engaging and permanent. You will have the ability to track your individual results, and all this can be achieved by downloading the Rally app to your iPhone or Android to take this with you on the go. All right. So, for those of you folks that are enrolled into the medical plan, you will have access to the Advocate for Me. This is where you need to turn to someone to ask questions on your medical plan with United Healthcare. You turn to them. Is this treatment covered? How much will I have to pay? This is on my bill. What does this mean? Can you explain my benefits? Help me out. You can access them either through the Advocate for Me at uhc.com email or by calling the number on the back of your card. I know you folks probably hear that quite a bit. Call the number on the back of your card. Those numbers truly do change based upon the enrollment and the plan where it's written, and it does give you a better and more routed resource with United Healthcare than just by calling the general 1-800 number. To that end, you will be able to reach out to United Healthcare with any questions at your myuhc.com account. But certainly here at the Capital Group, we're happy to answer any questions that you may have about your medical benefits. But to that end, folks, I kind of spoiled it a little. We're moving into our dental and vision portion of the presentation. And so I really appreciate your attention so far. And let's go ahead and review. So we are utilizing the Unum Dental platform for our dental plan. It is nationwide in scope. It is a PPO network, so we have both in and out of network benefits. However, we will truly get the most bang for our buck by sticking in network. We have an individual deductible of $50 and $150 for the family. That does change based upon how you enroll. Employee only $50. One or more persons, $150. Now, each person who enrolls under this plan will have an annual maximum of $1,000 to spend on eligible services. Now, if you are someone, not like me, but it's someone who goes just for your preventative services, exams, cleanings, and x rays, that's covered at 100%. You will not even need to touch your deductible. However, when you start to get your basic major or orthodontia services, you will have to meet your deductible. And again, that's either $50 for the individual and $150 for the family. And then you'll have the cost share of 80/20 for your basic services, which are fillings, periodontics, endodontics, and simple extractions. Your periodontics are your root scaling and planing, your really intense cleanings, and your endodontics are root canals. Covered at an 80/20 split, 20% your responsibility, 80% covered by Unum. Under major services, your bridges, implants, and crowns are covered at a standard 50/50 split. Now, orthodontia is available for child dependents up to the age of 19, and that's offered at a standard lifetime maximum of $1,500, and again at a 50/50 split. All right, folks. So we are now into our vision portion. And so with vision insurance, it is frequency based. So that's the first thing I like to draw out. So with this plan, that frequency means once a calendar year, we are able to get a new eye exam for a $10 copay. We're able to get updated spectacle lenses for our glasses with a $25 copay for your basic single, bifocal, and trifocal lenses. And with that $25 copay, we'll receive $130 to spend towards our frames. Now, if you are someone who wears both contact lenses and spectacle lenses, you have to choose one or the other with regard to the benefit. You cannot get both processed under the plan. And your elective contact lenses are covered up to $130. And if you are someone who needs to wear medically necessary contacts, meaning that your prescription is too advanced for glasses or unable to support glasses, that would be covered at 100%. Now, folks, I like to use vision insurance to really highlight the concept of out of network benefits. So, on our other plans, our United Healthcare plans, we have out of network benefits. We have a separate deductible to satisfy everything, all that said. But let's say, for example, we even satisfy our out of network deductibles and we go to a provider and we're starting to get reimbursements and starting to get coverages from carriers on out-of-network benefits. Well, let's use this as an example here. We can see up to 40 for your out-of-network reimbursement for an eye exam. If you go to that out-of-network provider and they charge $50, you pay that $50 out of pocket. You take that receipt, you file a claim with Unum and you submit it. And then in 6 to 8 weeks, you receive a check in the mail and it says, what? Only $40, but I paid 50. What gives? That differential is your responsibility. That's a concept known as balance billing. Really, I like to highlight that out of network benefits are really just reimbursement opportunities for out of network claims or with providers that don't have a contract. Understand you do need to meet that full deductible out of network. And for this case, with this plan, um, there's no out of deductible network to satisfy for your vision, but you can see it's up to $40, up to $30. You really see the maximum amounts that vision will cover out of network, which is why I will always encourage folks when, if possible, to stick in network. All right, folks, so we are switching gears into the income protection portion of the presentation, where we will close with our flexible spending accounts and final reminders and resources, and where we will also be able to host a brief Q&A session. All right, so let's go ahead and look at the employer paid life insurance benefit. So your beneficiary, as they are on file, will be able to receive a flat $25,000. This is for both a natural passing and an accidental death. Please make sure that you're updating your beneficiary information in the Employee Navigator platform um, during this time. The beneficiary information is housed by Paragon. This is not housed by Unum. So if the beneficiary information is not up to date and a beneficiary is looking to come file a claim and they are not listed, and that was the intent for them to be listed, there is nothing that we can do. All right, so now we are switching gears into the short term and long term. These are both employer paid benefits. For your short term disability, you will be able to receive up to 60% of your pre disability earnings, up to a maximum of $1,500. You will be able to start to receive your benefit after 14 days after no work due to accident or sickness. And you will be able to receive these payments for a duration of 11 weeks. Now, if you are on short-term disability and qualify for long-term disability, the 11 weeks that you receive payout will satisfy the elimination period on the long-term disability. It dovetails right from the short-term into the long-term disability rather, where you will be able to receive 50% of your pre-disability earnings up to a maximum of $6,000. Now you see here a 24-month own occupation. So for the 24-month own occupation, what that means is that if you are on long-term disability for the first 2 years and you are unable to perform the substantial and material duties of your job, you will be able to stay out and claim no issue. If, however, after that time, Unum will ask, are you able to do any job, anything, clerical, admin, something, changing it up? Are you able to do anything? And if you are, then you will not be able to stay out on disability. However, if you are unable to perform any job at that point, maybe the disability is too severe. If that's the case, you will be able to stay out on disability up to your Social Security normal retirement age. Right now, it is 67. We'll see what it is in the next 30 years. Could very well be higher. All right, folks. So we also have offered here through Unum accident insurance. This is at cost to you, the employee. This is not employer sponsored, but this is offered to you on a group level. So we do have preferred rates and pricing. Essentially, what this accident insurance covers is, as the name suggests, accident insurance. It pays a base lump sum off of the type of injury you've sustained and the treatment needed. The benefit can be used however the employee chooses. It is portable and all guaranteed issue with unlimited payouts for more than 50 plus covered injuries and treatments, including ER visits, burns, dislocations, and more. So this is a schedule of the benefits of the accident insurance. Wholly impossible to read on a small screen like this. However, you can see that it does host a whole option of covered conditions. So you're going to have hospitalization benefits, injury benefits, surgery benefits, and more. And next we have the critical illness. As the name suggests, it will cover you based on a critical illness. You can enroll in employee coverages of 10, 20, or 30,000, with 30,000 being the guaranteed issue. Spouses will receive 50% of the employee amount with a guaranteed issue of 15,000. Now, children are automatically covered under this plan, and this plan is used to cover you and your family for serious conditions such as heart attacks, strokes, organ failure, and more. The money is payable directly to the employees, and just like the accident plan, you can just choose how to spend the money. Child coverage will be included with the employee coverage. Spousal coverage is extra, and you receive benefits paid out based on the condition. So, for example, coronary artery disease is 50%. For minor is 10%. But if you have a heart attack, invasive cancer, benign brain tumor, loss of hearing, dementia, Parkinson's, you will receive a payout. All right, so now we are switching gears into our flexible spending portion of the presentation, and then rounding out with reminders and resources where we will also be able to host our brief Q&A session. I thank everyone for your time as we've covered these incredibly benefit-rich and comprehensive options available to you through Paragon. All right. So, with regard to our flexible spending accounts, we have our dependent care account. So, folks, this is used for a qualified daycare, licensed after school programs, uh, elder care facilities, day camps. The child must be under the age of 13. Now, the maximum election per household is $5,000, and you and your spouse must work outside of the home, or rather, for an employer based outside of your home. So, as Paragon is not based outside of anyone's homes here, you will be fine to participate in the dependent care account. And just so folks are aware, whatever you elect as your annual maximum, let's say you elect $5,000, you divide that into your payroll cycles, and that's the amount of money that is pulled from your paycheck and deposited into your dependent care flexible spending account. You must build equity in the plan. All right, so final reminders and resources, folks. So open enrollment is upon us for a effective date of 12/1. If you do not decide to enroll or make changes during this time, whatever is in the system after the open enrollment period ends is what will be locked in till the next open enrollment cycle. You will not be able to facilitate any changes unless you experience a qualifying life event, such as the birth of a child, adoption, marriage, divorce or legal separation, death of a spouse, or change in employment status. And when that happens, you will have a 30-day window to process that change. You will need to log into Employee Navigator, select life events, and process the life events changes. And from there, that information will be sent off to the carriers for processing. But again, you have a 30-day window to effectuate that change. So I'm not encouraging you to wait until the 28th day to do so. So if you get married, and let's say you got married on December 4th, congratulations. We have a 30-day window to get that process done. Get your marriage certificate just on hand in the event that it's asked. Go ahead and process your qualifying life event change in Employee Navigator, get that enrollment changed. But to that end, this is our one time of year to act. So please make sure that you are making the appropriate changes to your plan as needed. Finally, folks, this is the contact information here for the various carriers. United Healthcare for our medical and prescription, Unum for our dental and vision, and for our income protection, life and disability, and finally, ISOL for our flexible spending accounts. And then finally, contact information for us here at the Capital Group. So, folks, you certainly have a fantastic human resources team that will be able to answer any and all questions that you may have. However, we are certainly a resource that I encourage you to use as well. If you do have any questions, we are here and happy to help. Myself, Cole Kelly, and my colleague Doug Gray, who has been moderating the chat, and my colleague Susan Snyder, who is off this call, but equally important as well. And to that, folks, I appreciate your time. I will go ahead and stop the recording and answer any questions that we may have.